Great. Okay, so I'm Carolina Carvalho. I'm a cardiologist, and my goal today is to introduce you to Wear Red Canada, and also to talk a little bit about what is this movement about, and also later I will introduce our guest speaker. Okay, so I've been here working at Toronto Rehab for 4 years, and I have a special interest in women's heart health. As I said, let's move on. If let's see if it works. Okay, good. So before we start, we needed to acknowledge that this land is where the University Health Network operates, has been for thousands of years the traditional land of a bunch of people, right? And it's a huge opportunity today for us to reflect on that and to think what we can do ourselves to work towards true reconciliation. So a minute to reflect on that, and then we move on to our important meeting. So the agenda today is we will talk about Wear Red Canada briefly for 5 minutes. Then Dr. Caro Hernandez will talk about healthy eating for her heart. And I'm happy that she will address some questions that you raised during Christine's class. And we will also have time for questions and answers. And I invite everyone at home, not only here, to send the questions through our Q&A button. And also we will talk about the closing remarks at the end, okay? So first thing first, what is Wear Red Canada? So we celebrate annually across Canada on February 13, this moment to raise awareness about women's heart health. So these events are held across the country to serve as a reminder for all people in Canada, but especially for women, to be mindful, curious, and proactive in the management of our heart health and wellness. Why is it? Because in 2023, cardiovascular disease, and I'm talking about heart attacks, strokes, and other things, are still the leading cause of death among women. So we have a job to do to raise awareness and to do something together to change that landscape. Okay, so how it has started. So a lot of people have been working on this for many years, but finally in 2018, Heart and Stroke Canada published this very important document that is available on their website, showing that women are undertreated when they have cardiovascular disease, they are underdiagnosed, and unfortunately, compared to men, we also die more, okay? There are many other things that you can learn. If you don't have this document, we will post online for everybody that is at home, but also for everybody that is here and wants to learn more about that, okay? What is another resource for you? So you can access wearredcanada.ca and learning more about women's heart health and what we can do individually and together. So I posted here, if you go to learn, and there is a lot to explore, you can see the 5 key messages, and these messages were translated in several different languages. So if English is not your best friend's first language, no problems. You probably will find another language and you can share the message to the world, okay? To your family, to your friends. So that's one of the resources. And as I have already mentioned, unfortunately, cardiovascular disease is the #1 killer. We have here some of the messages, and this is not the objective right now. So I will skip this. I will leave the message for this whole week that we have together. And I invite you to access also our Cardiac College website. So in that website, if you are not familiar yet with this, you have this section called Women with Heart Online. And everything that we are doing throughout this week and also last week will be posted there. So if you are not able to join us in the next 2 sessions or today you are late, you can also access that in the next few weeks or even months, okay? So there are a lot of ways that you can learn more and also help us to do a better job. So at Ramsey, we've been celebrating this for many, many years, and Dr. Rajani Nijawan is one of the leading in this process, leading person. And then more recently, we have Lisa and also Tracy Colella and a lot of other people that has contributed to this moment here at Toronto Rehab. So it's my huge pleasure to have Dr. Lisa Coach, Lisa, here presenting with me, supporting, and also we will talk now about Dr. Caro Hernandez, okay? So that's what I had to say, and while we are moving seats here, I would like to introduce Dr. Caro Hernandez. So she's a cardiologist, and she has a lot of experience, is a specialist in cardiovascular prevention and rehabilitation. She has a master in science and nutrition and sports. I'm sure she will be more than capable today to answer the questions that you have asked in the last 2 weeks. So she's also a fellow of the American College of Cardiology. And this is my huge pleasure to have Carol here. Thank you, Karen, for coming.
Thank you, Carolina. Alrighty. So thank you all for being here. I recognize some faces. I'm thrilled and I'm honored to be here with you. And thank you to the organizing committee as well for everything you do. Okay, so today's talk is healthy eating for her heart. And so this session provides information for people living with heart disease, people at risk of heart disease, and caregivers, and to all of us. So I think we already have the answer of this question, but raise your hand who thinks the leading cause of death in women is breast and ovarian cancer. Good. So you were putting attention. And raise your hand if you think that cardiovascular disease is the leading cause of death in women. Yes. But surprisingly, back in 2019, they did a study where they interviewed a lot of women about the reasons they thought they were dying, and only 44% of women answered that the main cause for women's death was actually heart disease. So we're missing 56%, pardon me, that still is not aware that heart disease is the leading cause of death in women.
Carol, sorry, I interrupt you 1 second. I think they live.
Oh.
I see the old one. May I help you?
Of course, of course.
So just a second here. Yeah. Oh, it's not that one. What is yours?
Yes, it is.
Is this one?
Yes.
Okay, here we go. Yeah.
Yes. Sorry about that. Okay, just a caring and friendly reminder. I know you have reviewed this with Christine's amazing classes about why we are so different compared to men. Among many reasons, which we will review, but mainly because we have so many different symptoms compared to men. So we tend to have what we call atypical symptoms, and that makes it very tricky to diagnose and treat, and among other things. But we can even have just lightheadedness or dizziness or neck discomfort. So it could usually be mistreated, misdiagnosed, and there's usually a delay in the diagnosis when we have heart disease. And this is partly attributed because our heart obstructions are not the same as men. So this is the vessels in your heart, and these vessels are the ones that are seen through an angiogram. So perhaps that word rings a bell, but the angiogram is the way that we can see the vessels inside your heart. But with the regular angiogram, we are just looking at 30% of the blood circulation in your heart. So we're not seeing the rest, the 70% of the blood vessels in your heart, we are not seeing them in the usual angiograms. So this makes it very tricky because not only we don't have the regular symptoms, the typical symptoms, but also we are not seeing all this during the regular studies. So what do we need to do, and why are we here, and why we make such a big fuss and big deal of where we're at Canada? Why is it so important, and what do we need to do? So the first thing is know your risk factors. So you already know different risk factors, but I wanted to underline this risk factors particularly because they derive a greater risk to us women compared to men. So that means that the impact that these risk factors have on our heart is worse compared to men, unfortunately. So if our sugar control, if we have diabetes, if the sugar is not controlled, we will get worse prognosis. We are particularly more prone and more sensitive to stress and psychosocial alterations that can lead to heart disease. Smoking, the damage that smoking can cause in us women is much more harsh compared to men. As you probably know, menopause, just because the reproductive hormones protect us during childbearing age until we reach menopause, and then we have an increased risk. Pregnancy complications, if we have high blood sugar or high blood pressure while we were pregnant, this will increase our further risk of having heart disease. And inflammatory conditions such as lupus and rheumatoid arthritis also contribute to the increased risk factors and the effect they have in our hearts. But not only that, you know, cardiac rehabilitation can improve health and aid recovery from heart disease. However, women are less likely to be referred for cardiac rehabilitation than men are. So we're lucky if we are here in a way, but it is not the majority of women that have this privilege. So all taken into account, the very typical symptoms, the anatomy of the vessels, of our heart vessels, along with the different risk factors that we have that particularly to us women, they affect us more, this leads to an increased risk for heart disease. So, and let's not forget that we have the pink ticket. So almost all of us here, unfortunately, we do have this pink ticket. So I like to call the risk factors, and I usually tell my patients they're like lottery tickets. So the more you have, the more likely you are to win the lottery, but this is not the good lottery. And unfortunately, we already have one ticket that we will not get rid of. So all the risk factors, as you probably know, smoking, diet, weight, lifestyle, and not being active, each of them is different risk factors. But to today's talk, why are these risk factors relevant and what's the relationship with diet? So cardiovascular disease and diet, and I would like to focus primarily for today's talk on diet and gender because that's what we're here for, along with a little reminiscence of the other risk factors and how diet, gender, and lifestyle modifications and interventions can interfere with the rest of the risk factors. Why? Because the probability of developing cardiovascular disease is associated with unhealthy dietary patterns. So I want you to remember this slide. This slide will be the main slide of our conversation today. So let me read this to you. Nutrition might be the most preventive factor of cardiac complications. So let me read that again. Nutrition might be the most preventive factor for further complications. It could even reverse heart disease. So this very simple thing and the power it has. Not to mention that also the diet plays an important role in the other risk factors such as weight, hypertension, diabetes, and dyslipidemia. So it is not just an isolated risk factor, but also interferes with the other risk factors. So this is a study from very smart people down in Harvard. So what these guys did, they studied a lot of patients throughout many years, and they realized, they studied why they died, at what age they died, and what were they eating. So the interesting finding of this study is they came up with this 10 points that were common denominators for people dying primarily from heart disease, but also stroke and diabetes. So very interestingly, the people that died, the consumption of sodium was very high, more than 2 grams per day. Also, they were not eating nuts and seeds. They were eating high processed meats, low seafood omega-3 fats, that as discussed in your classes, salmon, mackerel, sardines, low vegetables, low fruits, high sugar sweetened beverages, low whole grains, low polyunsaturated fatty acids, which is extra virgin olive oil, and high red meats, unprocessed. So why is all this important? And you might wonder, why does diet has to do so much with risk factors in heart disease? Well, because risk factors and bad diet causes inflammation in the body. So what is inflammation? So inflammation are free radicals. So free radicals are substances that the body produces. For instance, these are the ones that make a tomato go bad. But the free radicals, we also have them in our bodies, and these free radicals are the ones that make our cells go bad as well. So just as a tomato you see here looks not delicious over here, that's the same way our cells turn out with free radicals and inflammation. So risk factors, along with diet, this type of patterns and practices in our diets lead to inflammation and these sick cells. So what can we do, and what are the dietary patterns that we usually advise to our patients? Bless you. The Mediterranean diet. So this is a very interesting study that helps, that was done in the Mediterranean in Spain. And this was an intervention they did with a lot of patients, and they gave them different diets, and also they followed these patients for many years. And they compared the diets with a normal Western diet. And they compared this normal Western diet with the Mediterranean diet with nuts, and the Mediterranean diet with extra virgin olive oil. And you can see this is a lot of numbers, but the bottom line is that at 5 years, there was a decreased risk of heart problems with the people that during 5 years consumed Mediterranean diet and extra virgin olive oil. And the effects of this diet, this very simple modification in these patients, were significantly very important, very big. Another thing that I find very interesting about this study, this Spanish study, which is called PREDIMED, is that they did also a study and analyze if these patients had genetic predispositions to having heart disease. And they wanted to see if these patients, even with having this genetic predisposition, if the diet had to do with better outcomes. And they did a lot of studies and studied all the genes of all these people. And they realized that actually, yes, even with genetic predisposition to heart conditions, being obese, having cholesterol alterations, even with those predispositions, diet was still a very important factor to decrease risk of dying. And a very hard data from this study is that the amount of improvement was even very similar to some medications. So for instance, 30% of the risk reduction shown in this study is similar magnitude to the reported in the statin trials. So eating a Mediterranean diet is the same as if you are taking your atorvastatin, your rosuvastatin, and maybe some of your other medications. So that's why Nutrition might be the most preventing factor of cardiac complication. This very simple thing and how powerful it is. So what's the Mediterranean diet? So a very brief, very general description: extra virgin olive oil, some wine, vegetables and fruits, different colors. The more the merrier, because colors means antioxidants, and antioxidants fight the free radicals, pardon me. Whole wheat grains, fiber, nuts, and omega-3 fats. And I want to tell you a story about this scientist. He's called Dr. Butner. He's an anthropologist. And one day he asked a question: why were the people living more than 100 years? Where were they? And what were they doing? And why were they living more than 100 years? So what started as a Nat Geo expedition, where they were trying to see why these people were living past 100 years, they realized that these people had common denominators, and they called them the Power Nine. So they called it a blue zone study, because every place where they found out people that were living more than 100 years, they put on a blue dot. That's why it's called blue zones. Okinawa, Japan; Sardinia; Ikaria, Greece; Nicoya, Costa Rica; and Loma Linda, California. And they gave this Power 9, but I want to focus, of course, for the purpose of today's talk, you eat wisely. So they set these 3 points in regards to diet: 80% rule, which we will talk about, the plant slant, and the wine at 5. So the plant slant means that these people were consuming a lot of vegetables, a lot of fruits, vegetables, nuts, seeds, extra virgin olive oil, so a lot of plants. And the meat they were consuming was mostly pork, and it was eaten on average only 5 times per month. And the serving sizes were 3 to 4 ounces, about the size of a deck of cards. So how often do you eat pork? And the 80% rule is from an Okinawan saying from Confucius: Hara Hashivu. It's a mantra that said that before meals, remind them to stop eating when you are 80% full. But it's not just what we eat, but with whom do we eat? So the other points of the Power 9 was that the Okinawans were eating with people they loved. They had techniques to downshift. They had purpose. And I want to read you this line that was very impressive to me: knowing your sense of purpose, which to the Okinawans is called ikigai, is worth up to 7 years of extra life expectancy. So that's a pretty hardcore data. And also some research from very important cardiovascular studies, which one of them is called the Framingham studies, showed that smoking, obesity, happiness, and even loneliness are contagious. So the social networks of long-lived people have favorably shaped their health behaviors. So consider that as well as part of your Power 9. And the other dietary pattern that was considered to improve heart health was the DASH diet. So this is called, it stands for Dietary Approaches to Stop Hypertension. It was created in the 90s, and it was initially created for people with high blood pressure, but they eventually realized that this diet was helping as well prevention of stroke and heart attacks and cardiovascular disease. So this diet predominantly is very similar to the Mediterranean diet: grains, lean protein, legumes, seeds, very few fats, a lot of vegetables and fruits, and they include low-fat dairy as part of this dietary pattern or this eating strategy. Or as I like to call it, a salad with a side of meat or protein. So let's talk a little bit more about exercise and diet. So the purpose of exercise is not calorie burning. So I wanted to show you this experiment, which was done by one of the doctors, Dr. Kivala from McMaster University at Hamilton. And they, and you probably have read the name or of the effect. It's called the afterburn. So they wanted to measure, depending on the exercise that you were doing, how many calories were you burning, but how many calories were you burning throughout the day? Because as I said, the purpose of the exercise is not burning calories. So they did two groups. One of the groups were bicycling, were riding for 1 hour. At the end of the session, apparently their watches mentioned that they were burning 550 calories per session for 1 hour of training. And the other group was doing interval trainings for half an hour, a much more intense workout, but for less time. And they apparently their watches said that they were burning 350 calories for that particular session. So what is the afterburn? So the afterburn is because of the exercise and the trigger of the exercise, we elevate our metabolism. And this is called excess post-exercise oxygen consumption, which means that even after you stop exercising, you're still consuming calories and your metabolism is increased throughout the day. So in order to prove that, this scientists measured the calories for 24 hours, and they compared both groups, the people that exercise for half an hour and the people that exercise for almost an hour. And the amount of calories that they consume for the whole day, even with this very different times of exercise, was the same, 300 versus 330. So the purpose of your exercise is not to burn calories. The purpose of the exercise is, as you very well know, all the other benefits that exercise gives you. But in this relies the importance of your diet and what you eat before your workouts and throughout the rest of the day. Okay, so a little celebrity family feud. So any volunteers for 100 points, 200 or 300? Okay, so for 100 points, what are the two proven dietary patterns that help your heart health? Yes, yes, wonderful, yes. So I know one of you raised the question about intermittent fasting. So the only two proven dietary patterns that help your heart are Mediterranean diet and DASH diet. Intermittent fasting, there's still a lot of controversy, and although there are very promising findings, some findings for intermittent fasting were attributed partly because of patients losing weight and not precisely the diet they were following. So that's why the two proven patterns for protecting your heart are Mediterranean diet and the DASH diet. Okay, 200 points. So we know we're not exercising for calorie consumption. We know how exercise will help. We know how diet will help us and protect us. So what can we eat before we exercise? What do you normally eat before you go and do your exercise? Any volunteers? Marlene?
Usually I would think not of eating before exercise.
Okay. For a particular reason?
Maybe drinking water, but not eating particularly.
Okay, okay. So this varies among patients, but the advice is to have a quick carb 45 minutes before your workout. So you have sufficient energy to cover that elevated metabolism during your exercise session, but also throughout the rest of the 24 hours of the day. So the quick carbs, yes.
So I have a follow-up question to that.
Of course.
Presentation, by the way. So would you have specific recommendations based on the type and the duration of the exercise that you're planning on pursuing?
Yes, So right now, thank you, Jess. So the question is if there were any specifics of the timing and the specific carbohydrates or meals as a pre-workout. Excellent question. So the main recommendation is to eat a quick carb because we're going to use it in a fairly subsequent time, so not in a long time. So quick carbs along with a little portion of protein. So what are quick carbs? Quick carbs are the ones that have a high glycemic index. So if you go online and you look for high glycemic index, you will find all these quick carbs. So all these quick carbs, you can eat them 45 minutes before your exercise session because these quick carbs are the ones that don't have fiber, which will lead to a much larger in time disposition of the energies from that particular food or pre-workout. So the answer to that question would be the ones that have high glycemic index are the ones that are much more recommended. And another recommendation is that they don't necessarily need to be sweet pre-workouts. And sometimes we normally think about fruits or something sweet or honey or jelly, things sweet. But also another option is to consider a smaller portion of your meals as a pre-workout if you prefer savory. Okay, and for 300 points, all Canadians need to be supplemented with vitamin D. Who says yes?
Yeah.
Yes. So true or false? True. Yes. So this comes from a Mexican that received a lot of sun throughout her life. But unfortunately, Canadians, we need to be supplemented with vitamin D. So each country has different recommendation. It varies throughout your life and it varies depending on the food intake and your dietary pattern. So this is some recommendations from Alberta, which are similar to the ones that we have here. But in regards to vitamin D, who needs testing? Not all of us need testing because the studies they've done in very large population have shown that living in this particular latitude leads to a lot of vitamin D deficiency. So hence, we all need to take vitamin D. You don't need to be tested? Yes.
Sorry.
No, please.
How would I know if I'm deficient in vitamin D?
Yes. So the question is, how would I know if I'm deficient of vitamin D? So the assumption is that we are all deficient based on large population studies, and particularly people that have medical conditions such as osteoporosis or other bone thinning diseases, malabsorption diseases such as gluten intolerance, renal disease, rickets, or patients taking drugs that affect vitamin D, which your physician will let you know about this. These people do need testing to further know their exact amount and their requirement. But the recommendation is that we all need to take vitamin D. So of course we need vitamin D because it helps us absorb calcium. Without calcium, not only your bones, but also your muscles can cramp, hurt, or feel weak. Sometimes we are deficient and we're not taking vitamin D and we don't even realize it and we're just weak. So our skin makes some vitamin D from sunlight. So you would need to be exposed daily to 10 minutes of direct sunlight in order to receive your daily requirements of vitamin D. And there's also vitamin D in the diet. So foods like egg yolks, liver, fish, such as char, herring, mackerel, salmon, sardines, and trout. All these, they have vitamin D. But apart from your diet, you need to consume 400 international units as a supplement for people younger than 75 and 800 international units for people older than 75 years. Yes.
70 years old or 75?
I've read 75, but I will confirm. and get back to you, because it over here it says 70. You're right.
And I have a follow-up question.
Of course.
So you can just take the vitamin D3 capsule. You don't have to take it with anything. I know at one time you said you should take vitamin D with
Calcium.
calcium.
Mhm. So the question from over here is if we just need vitamin D, or if we need to take it along with calcium or with other supplements. And the question is, to my knowledge, we just need to, the recommendation is vitamin D. But if you have a medical condition, and sometimes as women, we're very prone to have bone density alterations. So if we go and have a density scan, and we're found to have with some deficiencies, then those would be indications to have your vitamin D along with calcium. But that's on an individual basis, and it will depend on other studies and your other medical conditions. Righty, so I think I went a little bit ahead of time. Thank you very much. I'm open for questions.
Thank you very much, Dr. Hernandez. We learn a lot, and we have questions from the people at home. So someone is asking, I noticed one of the things mentioned was wine. I'm not able to drink alcohol. Can I have red grapes as an alternative? And just a follow-up question. We know that recently we had the new guidelines for alcohol consumption. So if you could shed some light on this topic, I think it's a good idea.
It's an interesting and fun topic. I love a good Sardinian wine. So yes, so it's an interesting question, because the advice is for us women to drink one glass of wine per day, and the recommendation for males is to consume 2 glasses of wine per day. So that's the allowance. Can we consume red grapes? Sorry, yes. So why is wine advised? So wine is advised because there are compounds in the wine called polyphenols that are the ones that help fight the free radicals. So the polyphenols, particularly called resveratrol, are the ones that help counteract the action of the free radicals, and that's why they are included in the dietary patterns recommended for heart health. Can you consume red grapes? Yes, although I'm not very sure of the exact amount of red grapes that you might need to consume every day, but certainly a fun question. Alrighty. Any other questions? Yes.
Sure. Carol, I guess my question, what do you think is the role of caffeine and coffee and antioxidants?
You're making my favorite questions. So the question is, what's the role of caffeine and antioxidants? So caffeine also has a lot of polyphenols, and also it's considered an antioxidant. Black coffee. So yes, so the advice is yes, caffeine also, and not caffeine, but the other compounds that we find in coffee. The particular thing about caffeine is that apart from having all these antioxidant properties, caffeine is the only substance, apart from a couple of other substances, that are used to improve your performance. So it has different benefits from different areas. It's called ergogenic, so that means it helps you with your exercise performance, and it will not interfere with your heart conditions. And it's the only accepted and proven pre-workout stimulant that we can use for exercise, along with the benefits of polyphenols and the antioxidant compounds that coffee has. Yes, Lisa.
I'm sorry, I stepped up briefly, so I apologize if you did talk about this. I'm curious about the role of timing of when you eat your meals throughout the day. Like, do you have to eat breakfast between 7 and 9, or you know, like this type of thing?
Great question. So the question is the timing of the meals throughout the day and its relationship with the healthy patterns. So from what I read from these two particular dietary patterns, there was a circadian relationship with the consumption of meals and food. So the relationship, that's why they were not recommending intermittent fasting or windows or selected windows, because they were as a whole considering the circadian distribution of the meals that we usually have with the prospect benefits. Although it hasn't been studied quite intensively, the exact windows, the relationship, because as we mentioned, the findings for the benefits for this restricted windows dietary patterns are more related perhaps to the loss of weight. And because of this, indirectly helps with your cardiovascular health and your lipid profile, but not directly because of the window restriction, if that makes sense.
Yeah, thank you.
Yes.
What are your thoughts about the benefits of green tea?
Mm-hmm.
I read it's very good, but I don't really like it. I'm kind of forced.
Yes.
If you were to tell me that my cup of espresso would be just as good, I would be very happy.
Yes. And you must invite us all because I do prefer espresso than green tea. So the question is, what are the thoughts of green tea as an antioxidant compared to coffee? And they're both antioxidants, and they both have caffeine as well. They're both antioxidants. They both have been proven to have some benefits. Particularly with caffeine, which you do have with green tea, and you have caffeine as well with the coffee. The only consideration would be that we have different tolerances, and this is genetic to coffee. So that's the only further thoughts I can say, but they're the exact, not exact, but both they give benefits.
Thank you very much.
Enjoy. Yes.
So you touched on women and psychosocial related issues. I was wondering, Dr. Hernandez, if you could maybe touch on specific foods that are proven to help boost your mood.
Mhm.
You know, when it comes to stress or depression, anxiety.
Yes. Interesting question. So the question is, what particular nutrients can help with the boosting mood and depression, anxiety, and the psychosocial aspect of these. So my thoughts are that the studies were not targeted towards individual nutrients. So the studies, in particular heart health, they were targeted to dietary patterns. So the conjunction of extra virgin olive oil, low sodium, low processed meats, whole wheat grains, seeds, nuts, fish, omega-3, wine, love, communion, ikigai, whatever you want to call it. So the dietary pattern, what were you eating? Broad, like all the dietary pattern itself and the conditions that you were eating, that's what led to the benefits. But they didn't analyze particular in isolated nutrients. There are a lot of them, adaptogens, some infusions, roots, things that can help and are very, very well, not studies, but have been used in other cultures for thousands of years, and they do have effects on this particular psychosocial. But for our Western approach and the way they assess the dietary patterns, it was the overall pattern. But to be continued, there's a lot of things that curcumin, ginger, golden lattes, ashwagandha, reishi, I don't know, a lot of things. Green tea.
I'm really happy today.
Yes.
After heart surgery,
training and everything in human?
Yes, love that question.
Is there any?
Yes, of course. So the question is, are we allowed after heart surgery to eat everything in moderation? And the answer is yes. So part of why we're talking about all these things, apart from your cardiac rehabilitation and the exercise, a very important of cardiac rehabilitation is the recommendations of what you can eat. So that's why we have had all these workshops and all this conversation around what can you eat, what's the exact amount. Sometimes we hear the word Mediterranean diet, but we don't know the specifics. But yes, you can eat a lot of things, and you can. If everything's in moderation, life is short. That's what I always say. If you enjoy a piece of cake every once in a while, life is short.
Doctor,
Yes.
you mentioned about having a meal with a purpose.
Mackenzie, please call reception. Mackenzie, please call reception.
You know that
Thank you.
nowadays we talk a lot about mindfulness.
Mm-hmm.
There is also a movement about mindful eating. But
Mm-hmm.
I think that may be aligned a little bit with that. So could you
Of course.
share your thoughts?
So the comment is the mindful eating and how that interferes with our topic. So of course, purpose. So the Ikigai from the Blue Zones story was more related to the purpose of your life, like having a purpose, a sense of purpose in your life, something that makes you wake up in the morning. But of course, mindful eating, I'm sure it contributes to a lot of the benefits that are attributed to this dietary patterns. Thank you. Thank you.
Okay, so I want to thank Dr. Hernandez very much for this presentation.